Hi, this is Peyton Klein. This is my sterility competency. I have an order for Miss Harumi, who's a female, date of birth 3383, ID number 160011180. She's been admitted for acute kidney failure syndrome, and she's scheduled for multiple diagnostic tests tomorrow and needs strict INO. Anticipating this, the doctor orders anchor retention catheter to a dependent drainage system stack. So, first, before I gather my supplies, I would wash my hands. And here I have a 14 French Foley catheter. It's intact, unopened, and unexpired. And then I have my sterile gloves, which are also intact, unopened, and unexpired. In my room, I have a basin and towels for pericare, tape that I'll need later, a pen to document, and clean gloves. So I'm going to go ahead and enter my patient's room. And upon entering, I wash my hands. Hi, Miss Harumi. My name's Peyton. I'll be your student nurse today. We're going to be putting in a catheter that'll hopefully drain that urine from your bladder and make you feel a little more comfortable. Is that okay? And she says yes. And I ask if she can verify her name and date of birth, and she says Ren Harumi 3383, which matches my order. Then I would ask to look at her ID band. Ren Harumi 3383, 3383, 160011180, 160011180. So those match, so I know I have the right patient. I'm just going to ask her a few level of consciousness questions. Can you tell me where we are right now? She says UK College of Nursing, and then can you tell me what day of the week it is? And she says Monday, so I know she's oriented times 3. And now I'm going to ask her about her allergies. Miss Harumi, are you allergic to betadine or latex? And she says no. And I ask her if she has any other allergies, and she says no. So I know that the procedure will be safe and she won't have any kind of allergic reaction. So first I'm going to wash my hands. And actually first I would raise the bed to waist level. I can't raise this bed, but in a real setting I would. And I'd lower the side row closest to me and wash my hands and apply clean gloves. I didn't have any medical gloves, so I'm just going to pretend that these are. So first I'm going to take a look at her bladder. So first I'm going to palpate. My expected finding would be that it'd be slightly distended, and then I'm going to percuss. And my expected finding would be dull sounds over distended bladder. So I would discard of those gloves in the trash and wash my hands. And then I would assess for pericare while providing as much privacy as possible. And I already provided privacy when I walked in the room. So I see that she needs pericare, so I'm going to wash my hands. And these are a new clean pair of gloves. So I'm going to apply those. And then I have my basin and my towels for pericare. So I'm going to get this sheet out of the way. Alright, so here is everything I need. This would be filled with warm water. So use the big one for later. First, I'm going to use one part of the towel, dip it in the warm water, spray soap on it, and then with my non-dominant hand, I'm going to spread the labia to expose the meatus and go away from me. Use a new part of the towel, spray soap and water, go the side nearest to me, and then flip it inside out and go down the middle. So then I'm going to do the same thing using just water so I can rinse off the soap. So side away from me, side nearest me, and middle. So then I'm going to just go ahead and pat the area dry. Okay, and then put this out of the way, remove my gloves, wash my hands, and now I'm going to go ahead and start setting up my sterile field. So I'm gonna grab my catheter kit. This is all the way. And then I'm going to only touch the corners and go away from me, to one side, to the other side, nearest to me, so I'm never crossing over my sterile field. And now I'm gonna go ahead and sterile glove. So I'm gonna keep this in my line of sight at all times. Wash my hands. Go over to my table to sterile glove. So I'm gonna open the package. It's outside here. And realize that these parts that are off of the table are not sterile anymore. So, okay. So I'm gonna pick up the first glove by the cuff. Make sure that it stays above waist level. Pull it down, and then I can fix that later. And then I'm going to keep my thumb out and use my 4 fingers to, okay, apply the other glove. And now I've sterile gloved. I'm gonna get that out of the way. So now I'm ready I can touch my sterile field now. So first I'm gonna drape. So, since I'm sterile, I can touch everything on the field. So I'm gonna be careful to not, this is a little caught. Okay, that ripped a little bit, so I'd get a new one. But I'm gonna be careful to not cross my arms over the sterile field, so I'm gonna hold it like this, and then drop. Okay, so now I'm gonna set everything up before I have to contaminate my non-dominant hand. So, go ahead and adjust that. Going to take out my catheter. And then every time I take something off of my sterile field, I'm gonna bring it out and over and drop. And that's now my area that I'm gonna designate as my trash. So first, I'm gonna pour betadine over the cotton balls and drop. And then I have my lubricant here, and I don't need this cup, so I'm gonna get that out of the way. So I am going to first get this lubricated, the catheter, and then just leave that for later. In my tray. And then I have my forceps, my cotton balls. I'm gonna go ahead and get rid of this lubricant since we're done with it. Out, over, drop. So now I'm gonna screw the water syringe on to the catheter. So that's gonna connect here. So I'm gonna remove the cap away and drop. And then screw this in. Make sure that's in good. Okay, so now these are soaked in betadine. So I'm going to pick it up, and now I'm gonna contaminate this hand. So I'm pulling the labia apart, and I'm going to go away from me, pull it out, drop, and then side nearest to me, drop, and down the middle. And then at this point I'm gonna drop everything because I don't need it anymore. My hand is anchored here, it's not moving. And now it's time to insert the catheter, so I'm just gonna move everything a little bit closer, make sure nothing's tangled up. Okay. So I'm gonna insert this, and I'm holding it about 2 inches from the tip. I'm not going to touch the outsides, only go straight directly into the opening. And I'm gonna insert it about 3 to 4 inches. After I see urine flow, I'm going to go about 2 more inches, or an inch or 2. And so I'm gonna say, Miss Harumi, could you take a few deep breaths for me? I'm about to insert the catheter. So I'm gonna go ahead and insert. And without touching the edges, put it in, and then clasp. Okay, so now I'm gonna pick up the syringe and push to inflate the balloon and pull out. And now I don't have to be sterile anymore, so I'm gonna unhook this. Okay, so now the catheter is anchored, so I can clean up. So this would go into my trash. Okay, so now I'm going to dispose of my sterile gloves. And I'm going to make sure my patient's comfortable. I'm gonna wash my hands. And then I'm gonna tape it into place. So, that piece looked a little dirty. So, I would apply a piece of tape to the leg. And then there we go. So now that bottom layer of tape is just to prevent skin breakdown. Untangle this. So make sure there's no kinks or anything like that. My bed doesn't have an attachment point, but on a hospital bed, I had to anchor it to a non-movable part of the bed and make sure it stays below the level of the bladder. So before I would have taped it, I would have performed peri-care again. I would have applied, washed my hands, applied clean gloves, done it exactly as I did before, and then taken my clean gloves off and washed my hands again. So now that it's anchored, I'm going to go ahead and recover up my patient. Make sure they're comfortable, see if there's anything I can get them. I'd raise the side rail and then lower the bed back to its original position. And then before leaving the room, I'd wash my hands. And then I would document. So I would say I inserted a 14 French Foley catheter. Urine characteristics, the color was a light yellow. It was a moderate amount. The client tolerated the procedure well. And that would be all.